please tell us about the magnitude of the non-compliance that is being faced at the Arvind Eye hospitals?
The non-compliance, it's more in the specialty clinics, probably because of, especially in clinics like retina clinic. I can't give you the exact figure. Probably I would say it's about 30 to 40%. More so because of the fear for the patients. So fear in the sense, like, people are like, especially in the retina clinic, like, the fear of having the treatment because they are not well aware of the condition. So probably many a times it's just because they don't understand the disease and the implications of it. So, and also people telling them, other people telling them about going for treatment and losing vision and things like that, especially in patients who have retinal problems.
What are the barriers that are faced to compliance in our Indian settings, particularly to our settings?
Again, the main problem is ignorance. Patients are ignorant of the condition. They do not have any awareness about the problem. And also, there are a lot of other people, people listen to hearsay. Like, many a times it's a patient who's going for laser treatment who might have dropped some vision because that's a natural course of the disease. These patients would tell the other patient that, not to go for treatment. If they go, you lose your vision and things like that. That's one thing. The other problem is accessibility. For these patients to come regularly, it is not possible because of the economic conditions they are in. For them, if they come here, they lose the entire day's wage. They can't come alone. They usually need to bring an attender. So all these things are taken into account. They are not independent. So they tend to put away these things because this is not their priority.
What are the strategies that are being followed currently at the hospital to increase the follow-up rates?
One, we are doing an increased counseling with the use of counselors and the doctors repeatedly telling them, improving the awareness by educating these patients with various routes, either through signboards or videos and stuff like that. Plus, when their patients don't come, we, especially in the specialty clinics, we write to those patients who are not following up. Sometimes we even call the patients. Of late, we have been using SMS in the cell phone because today everybody has a cell phone, so we do tend to SMS these patients for bringing them back for follow-up.
What are certain strategies which you think can be used which are not yet being implemented or fully utilized?
Most important is repeated counseling or improved counseling for these patients. Patients, once they are aware of their problem and understand the consequences, whereas the other thing is the use of cell phones. Today it is very simple, very easy, so we are trying to see how we can have automated information going to the patient to remind them of their follow-up and things like that.
What are the challenges faced particularly for diabetic retinopathy compliance?
Diabetic retinopathy patients usually come to you only when they have lost part of their vision. And very often we do tell them that it is only possible to retain whatever the vision they have and may not be possible to bring back their normal vision. So these patients, and also in the course of the time, during the procedure, during the follow-up period, sometimes they lose vision because of the natural course of the disease, and this scares them away from treatment. So if we have to keep improving the counseling, awareness among these patients, and stressing on the importance of follow-up for these patients, then we can improve the compliance, especially in patients who have diabetic retinopathy. Because these patients do not come to you in the early stage, they come only when they start losing vision. So at that time it's very, very difficult to treat them, as well as the follow-up period is difficult, and they have to understand that they have to follow throughout their lifetime.
How feasible is the introduction of a package system? Like a patient pays for 1 whole year of treatment, so he has already paid for the treatment, he is more likely to adhere. How feasible is it for our setting?
Like, as a basic follow-up package we probably could do, but this works more because there have been many centers which are actually coming up in this same principle of having a membership fee, and then these patients are followed throughout the year. Whereas when you start, these are the treatments which is the major, the expensive part in our setup. Especially if you look at even the paying patient, he hardly pays anything for a routine examination, but if he has to undergo laser treatment, that has to be individualized. So you cannot tell at the beginning of the year whether this patient is going to need treatment or not. So there the package system doesn't help in a way. Whereas suppose you are saying that these patients will need routine investigations, like a diabetic patient who will have every 3 months you will do all these blood investigations to monitor them. There you can have the package system. Whereas if suppose the patient needs any intervention, then they probably would charge them extra. Whereas here our basic examination is very minimal. The charges are almost negligible. Only the treatment is expensive. So that treatment we cannot package it for every patient.
Thank you.
Right.
Thank you, sir.